Series of engagements with different sectors of society on the COVID-19 pandemic. For more on this, we cross to our reporter Samkele Maseko, who's standing by for us in Pretoria. Thanks very much for joining us, Samkele. What's the latest where you are?
The meeting with traditional leaders is currently ongoing, with the Deputy President David Mabuza currently chairing that meeting. When the Deputy President finished with his opening remarks, we were asked to leave, as it was now a closed session, and the Minister of Health, Dr. Mabuza, was taking over to update traditional leaders on the latest figures and on the latest travel arrangements that many South Africans, particularly around the Easter weekend, may be making to rural areas, saying that with the Deputy President that they are relying on traditional leaders to relay the message to ordinary South Africans on the ground who may not particularly have the necessary information through social media of what is required of them and how to maintain themselves so that they're not infected and affected by this COVID-19 virus. The Deputy President going as far as to saying that largely the globe has been reactive in the manner that it's been dealing with this COVID-19 pandemic and not being proactive in combating the spreading of this virus, saying that the measures announced yesterday evening by President Cyril Ramaphosa were very drastic but are definitely necessary in spreading the curve of this COVID-19 virus, which now 554 South Africans have tested positive as of the latest numbers at 2300 hours yesterday, as announced by the Minister of Health, Dr. Mabuza. But let's just listen to the Deputy President David Mabuza speaking about how the globe has dealt with this particular pandemic.
The global response has largely been reactive instead of being proactive. What we are trying to say is that we've been reacting, and the pandemic is accelerating at a fast pace. The lockdown presents us with an opportunity to break the transmission. We hope it's going to work. When people are at home, we have disrupted the transmission of the disease.
That was the Deputy President there speaking about how this particular pandemic is sweeping and causing havoc across the globe and spreading like wildfire. But interestingly, a very topical issue which has not been getting so much airtime is the issue of transmission of this COVID-19 virus, particularly to the rural community and to those who are impoverished and downtrodden. Our colleague Ayanda Mhlongo just this weekend went to Ulundi to speak to some rural communities and what they know about this particular pandemic. Not many of them had a clue on how to deal with this pandemic. Some are facing a scourge of not having any water. They are using rivers to have access to water. There's no running water where they have. There's also a problem of electricity. Some areas have not been electrified, and the communication of this particular pandemic has not filtered down to the ordinary mass on the ground, as that came out of the engagements and the interactions our colleague Ayanda Mhlongo was having down in KwaZulu-Natal. So now the Deputy President David Mabuza has come out to the fore as to saying that much needs to be done to avoid a situation where this pandemic goes down to the townships and in particular to the rural areas. Minister Mabuza saying that this could be heightened with the Easter weekend coming up, and many people, particularly in urban areas, as they will be moving and going to visit their relatives, particularly in the rural areas. Let's just listen to the Deputy President saying that it's a matter of time before this particular pandemic reaches those who are impoverished and have nothing in the rural areas.
While so far, most of these infections and cases have been confined in urban areas, it is only a matter of time before this pandemic reaches our rural areas where our traditional leaders live. It's a matter of time. And if not prevented now, The time is now to prevent further spread into our areas. This is a pandemic that is highly infectious and one that has no borders. It affects young and old, black and white, poor or wealthy.
The Deputy President will, after his meeting, which he's currently chairing now, be addressing and be speaking to the media on the outcomes of this particular meeting with the traditional leaders. It is expected that a representative from the House of Traditional Leaders will also give feedback as to how far they've come with the deliberations of this meeting being chaired by the Deputy President David Mabuza, which was actually meant to be chaired by President Cyril Ramaphosa, who couldn't make it, but instead sent his Deputy President to engage with the traditional leaders alongside the Minister of Culture, that would be Dr. Nkosazana Dlamini-Zuma, and the Minister of Health, Dr. Zwelini Mkhize, and the Minister of Police, Bheki Cele. They're supposed to find a way and map a way forward for how this particular virus and pandemic can be curbed into spreading into rural communities, and how traditional leaders could help the government in spreading the message and helping those in poor communities to avoid getting and it being infected and affected by this particular pandemic.
Samkele, before I let you go, if the government is so earnest for there not to be a spread to rural areas, and of course the Easter time is the traditional time when people go from Gauteng and other areas home, Gauteng is an area which has the most incidences of the coronavirus. So the government is seriously going to be allowing people to travel to and fro Eastern Cape and all the other places around the country when we're currently faced with this pandemic. Is that what you're telling us?
Those are the questions that we'll definitely be posing to the Deputy President, David Mabuza, and the Minister of Health, Dr. Zwelini Mkhize, and the Culture Minister, Dr. Nkosazana Dlamini-Zuma, and how they will try and prevent that those who may be infected do not travel to these particular rural areas. What measures do they have in place to make sure that those that will be on our roads after this 21-day lockdown, which comes into effect this Thursday at midnight, that they avoid this particular situation and that they have their ducks in a row in allowing those that who may want to travel and make sure that they are negative of this particular pandemic. But at this point in time, the government does not have any measures in place to stop those who may be positive of the particular virus without knowing of traveling to their rural destinations to go and have and enjoy the festive season with their particular relatives. But also, if you look at the army document that was sent out of the various specifications of their command that has been issued by the Commander-in-Chief of the Armed Forces, President Cyril Ramaphosa, it says that they will be deployed into the various areas of deployment in the 9 provinces and will be commanded by those particular provinces for the period of the next 21 days. But there is an option to extend the army's stay if this virus or this pandemic continues to spread for another 3 or further 3 months. So that's an issue that has to be deliberated upon in assessment once the 21-day lockdown is done to make and to quantify if the measures that have been put in place to curb and to prevent the spreading of this particular virus or pandemic has indeed worked or not. The Deputy President is saying that they are hoping that this one measure of the lockdown will help in that measure. But as it stands, they don't have any plans to stop those who may be wanting to travel to rural areas after the 21-day lockdown.
Thanks very much, my colleague there, Samkele Maseko. Despite the President